All right, this is Dr. Wolfe back with part 5 of the JFK Autopsy. If you haven't seen parts 1 through 4, I recommend going back to review. And I am a forensic pathologist with an expertise in gunshot wounds, and I've been asked to look at this particular case. So let's go to this bottom paragraph. This is on archives.gov if you ever want to read the autopsy report. The second wound, presumably of entry, is that described in the upper right posterior thorax. So, in other words, the right upper back is where the first bullet went in. Beneath the skin, there is ecchymosis of subcutaneous tissue and musculature. Ecchymosis refers to kind of like a collection of blood, hematoma, bruising, and that's good evidence that the heart was still beating at the time that that bullet came in, which is consistent with it being the first shot. The missile path through the fascia and musculature cannot be easily probed. So sometimes when we see bullet wounds on the body, we will actually take a metal or plastic probe, a very long probe, and try to pass it through to get the path of the gunshot wound. It's not something that's done a lot in soft tissue wounds because you can artificially produce a pathway, so that's not good. It's better used in areas where bullets pass through bones. Okay, and in this case, the bullet passed in the right upper back through and out the neck. There wasn't a good bony pathway, so it wasn't easily probed, is what he's saying, and it's not surprising given the area. The wound, presumably of exit, was that described by Dr. Malcolm Perry of Dallas in the low anterior cervical region. So low down here, anterior, front of, and cervical region means neck. When observed by Dr. Perry, the wound measured, quote, a few millimeters in diameter, end quote. However, it was extended as a tracheostomy incision, and thus its character is distorted at the time of autopsy. So, in other words, the ER doctor saw it. He was in a life-saving situation. Actually, Kennedy was already dead, but they were giving it the full go, the full code, so to speak. You have to understand this. The president of the United States, his wife, and a bunch of Secret Service people are standing out there, and they're doing all they can to try anything. And of course, it doesn't work. And one of those things they tried was a tracheostomy, putting a tube in the neck here. And occasionally, an existing gunshot wound will be used for that sort of thing. I've also seen it used for chest tubes. Um, but it's really something, as the forensic pathologist, we hope the doctors don't do. If you can avoid a gunshot wound, it's really helpful for us because you need to be able to study that wound as it is. This one has an incision across it, which is problematic. And the only description was that the doctor said it was a few millimeters in diameter. Well, rifle wounds can actually produce small exit wounds. They can also produce very large exit wounds. So it's not terribly helpful, but I have seen cases where a high velocity rifle round has passed through the body and the wound was only 4 or 5 millimeters. However, there is considerable ecchymosis um, of the strap muscles of the right side of the neck and of the fascia, which is a connective tissue about the trachea adjacent to the line of the tracheostomy wound. So this is an important observation because it also shows that the heart was beating, blood was pouring into the tissues, and that's consistent with it being on the same wound pathway as entering the right upper back. The third point of reference in connecting these wounds is in the apex or supraclavicular portion of the right pleural cavity. Pleural cavity is the chest cavity where the lung is. In this region, there is contusion of the parietal pleura and of the extreme apical portion of the right upper lobe of the lung. So the apical portion is the very top, like apex of the lung, and the parietal pleura is the connective tissue that is on the inside of the ribs. Uh, this is something that we see when a bullet passes through and produces a shock wave. I'm going to show you what that's like in just a moment. In both instances, the diameter of the contusion and ecchymosis at the point of maximal involvement is 5 centimeters. Both the visceral and parietal pleura are intact, overlying these areas of trauma. So those observations are important because it says that the bullet did not enter the pleural cavity. But let me show you why, even when a bullet doesn't enter a pleural cavity or pass through a particular organ, it can produce a lot of damage. I'm going to show you a little video. Okay, this is a video of ballistic gel, and as you can see, the bullet is passing through, but it's producing a very large shock wave or temporary cavity. That energy is transferred into the tissues and can produce injury.